Today the topic is nystagmus. Nystagmus is a vision condition that refers to the rhythmic condition of eyes. For the better understanding the nystagmus, we should first consider the topic vestibulo-ocular-reflex, that's VOR. The vestibular system detects the head movement, in response of which the system helps to move the eyes in opposite direction so that the object remains focused to the fovea. For example, if you turn your head to the right, your eyes automatically move to the left side, and that's a VOR system. So, during the acceleratory movement of your head in the semicircular canals, the fluid that is present, the endolymphic fluid, it moves towards the cupula. And there, the cupula moves towards the highest filament of the hair cells, and that causes the hair cells depolarization. That depolarization leads to the activation of the vestibular nerve, and this stimulated vestibular nerve goes to the brain stem. So before moving to the forward, I want you to know that when you look to the left by turning your head to the right, so there's an activation of the left lateral rectus muscles and the right medial rectus muscles. For the activation of such muscles, there is underlying activations of third and sixth nucleuses in the brain stem, and there is a whole pathway. So previously we have told you that about the vestibular nerve activation. That once this nerve activated, comes to the brain stem and activating this nucleus. So the vestibular nucleus, once it activated, you can see the green pathway is the excitation of the extraocular muscles, and the red pathway, it shows the inhibition of the extraocular muscles. Once this vestibular nucleus activated in the right side, so the nerves emerges out from the vestibular nucleus and goes to contralaterally abductor nucleus. Now this abductor nucleus controls the ipsilaterally left lateral rectus muscles, and they emerge out the one of the nerve that goes contralaterally to the third nucleus, that's the oculomotor, and it goes to ipsilaterally the right medial rectus muscles that controls the medial rectus muscles of the eye. One thing that I also want to mention here, that this third nucleus, that the nerve that emerges out from the abductor nucleus to the third nucleus, it passes through the MLF, that's a medial longitudinal fasciculus. Now for the left eye movement, the left eye lateral rectus and the right eye medial rectus both are activated. Now the eye moves to the left side. But there is also the one thing, that inhibition of the extraocular muscles for the another muscles. So for that, when you turn your head to the right, so on the left ear, there is a hyperpolarization occur. Of course, there is a movement of the endolymph in the opposite direction. So for the movement of the opposite direction of the endolymph, there is a hyperpolarization occur in the nerve of the vestibular nerve. That hyperpolarization also causes the hyperpolarization in the vestibular nucleus, and that causes the hyperpolarization automatically to the left medial rectus muscles of the left eye and the right lateral rectus muscles. So here we go, it's a complete pathway of VOR. The one thing I want to mention here, that this VOR is a very slow process. You can see the normal process here. So I'll join you in the next video for the part 2, for the nystagmus complete video.